Hello dear colleagues, how are you today? I hope you are well. Here we are going to explain another question of dermatology. An 18-year-old female is reviewed in the dermatology clinic complaining of scalp hair loss. Which one of the following conditions is least likely to be responsible? A. Porphyria cutanea tarda. B. Discoid lupus. C. Tinea capitis. D. Alopecia areata. E. Telogen effluvium. Okay, here we have an 18-year-old female is coming with scalp hair loss or alopecia, and it's asking the least likely responsible. Okay, Porphyria cutanea tarda. The choice here can be Porphyria cutanea tarda because Porphyria cutanea tarda is the cause of hypertrichosis, not the cause of alopecia. Discoid lupus, tinea capitis, alopecia areata, and telogen effluvium are the cause of alopecia. Okay, the answer, as we said, is Porphyria cutanea tarda. Explanation: Porphyria cutanea tarda is a recognized cause of hypertrichosis. As we said, alopecia may be divided into scarring due to destruction of hair follicle and non-scarring due to the preservation of hair follicle. Here we have scarring alopecia causes trauma and burns. They can cause scarring alopecia. Radiotherapy, Lichen planus, discoid lupus, tinea capitis. If scarring may develop in untreated tinea capitis if a carrion develops, but if carrion is not developed, tinea capitis can cause non-scarring alopecia. Okay, here we can see different types of scarring alopecia in different patients. Here we can see a scarring alopecia in these patients may be or tinea capitis, which carrion is developed. Here we can see non-scarring alopecia in this patient, and here we can see scarring alopecia in the patient with discoid lupus. Here we can see scarring alopecia in this patient also. Non-scarring alopecia, like male pattern baldness, is alopecia, but it is non-scarring alopecia. Drugs like cytotoxic drugs like carbamazepine, heparin, oral contraceptive pill, colchicine, these are all cause of non-scarring alopecia. Nutritional, like iron and zinc deficiency, they can cause alopecia, non-scarring type. Autoimmune disease like alopecia areata can cause alopecia alopecia like autoimmune. Here we can see this can be alopecia areata in this patient. It's non-scarring alopecia. Okay. Telogen effluvium, hair loss following a stressful period, like example in surgery, in pregnancy, in chemotherapy. Okay, telogen effluvium. And trichotillomania is the cause of non-scarring alopecia. In this occasion, the patient pull his or her hairs out. Okay. Cause of non-scarring and scarring alopecia with mnemonic. In non-scarring alopecia, mnemonic is that's STD, and the mnemonic is tinea capitis, non-inflammatory type, as we said. Hormonal, like hypothyroidism, androgenetic alopecia. Anagen effluvium, like alopecia areata. Trichotillomania, as we said. Secondary syphilis, moth-eaten alopecia, SLE, or systemic lupus erythematosus, and telogen effluvium, as we said. Deficiency of zinc and iron are the causes of non-scarring alopecia. We can see in this photo non-scarring alopecia. Okay, and scarring alopecia, the mnemonic is STD-DVL. Like S is for scleroderma and T is for tinea capitis, as we said. Inflammatory type, when crayon is formed, it can cause scarring alopecia. Folliculitis, decalvans can cause scarring alopecia. DLE or discoid lupus erythematosus, as we said, it can cause scarring alopecia. We can see scarring alopecia in this patient with the diagnosis of discoid lupus erythematosus. Okay, there is one point. Systemic lupus erythematosus is the cause of non-scarring alopecia, but discoid lupus erythematosus is the cause of scarring alopecia. Lupus vulgaris is the cause of scarring alopecia, and Lichen Planopilaris is the cause of scarring alopecia. Yeah, we can see scarring alopecia in this patient. Okay, this was a short explanation about different types of alopecia and and the causes of scarring and non-scarring alopecia. Thank you for your attention.